substance abuse treatment facility. It's not behavioral health, it's substance abuse specific. You cannot report certain ways, right? But what happens if you receive somebody that has like a spousal abuse? Is that reportable?
Yes.
No.
Really?
Because you can't file a report. Who has to file the report?
The healthcare provider?
No. Who has to make a report if it's adult abuse, harming another adult?
The victim itself, right?
Right, the victim themselves. See, we haven't hit that on this chapter yet, but it's abuse still, but it's not considered a vulnerable person. So when they don't want to do the reporting, what can you do as a nurse?
Can you call the anonymous line?
Anonymous line.
Not the anonymous line. What we want to do is provide a safety plan. So when they're ready to report or get away, put a plan in place. Give them the hover line number. But you want to do it where the person, if the violent person finds this information, they don't know what it is. But you want to help them develop a safety plan. Get out of the area, get safe and get free. So when they're ready, they'll leave. Okay, so with abuse, you've got the child, the elder abuse. You could have somebody that may have intellectual disabilities. Or it could be, you've got to remember that when you see domestic violence, you can't make the report. You can't file the police report. But then what you can do is you can counsel, be non-judgmental, be open and listen, and then help them develop a safety plan. So when they're ready, they can implement it. So that's the big broad of that type of abuse. Besides, of course, your peer stuff. Okay, so what about aggression? How do you respond to aggression? What have you learned so far?
To talk to them calmly, to try to diffuse the situation.
Okay. For safety purposes, what do you do with the people that are in the area?
You remove them.
Okay. Do you ever leave somebody alone once they start to become aggressive?
No.
Okay, very good. So you keep them distant, keep them separated out. Okay. All right. So what did we learn about alcohol assessment? What do we do with alcohol assessment? What are some of the things?
That we do the cage assessment for alcohol as well.
Stop.
Yep,
We have to do a cage assessment.
you got it. When was that last drink? Those vital signs. Yep. So that's exactly on target. So very good. Okay. We're just going to get into the eating disorder stuff, but what would be some of the symptoms for anorexia? Because you guys should have started to read that chapter. You remember?
Very low BMI, less than 15.
Dehydration.
Maybe dehydration, but there's more obvious signs. Because dehydration, that's in a rare, very severe state. What would be some of the obvious states of that anorexia?
Underweight.
So
Low.
Social.
So the underweight, they're very underweight. Their BMI is very low.
Social isolation.
Sometimes social isolation, not always. They're starving themselves.
Self-image, how they view how their body.
They're the distorted self-image. How are they dressing a lot of times?
In bigger clothing.
Bigger clothing. They may layer their clothing so that you can't see how underweight they are. What about exercise?
They're addicts.
They're excessive exercising. Yes. Lots of excessive exercising. Minimal input of food. So what perception of binge eating for them would be eating 3 grapes. That would be a binge for them. You could see purging, but it's not always for someone with anorexia. What else might you see? What's having the fine baby hair all over their bodies? What's that called?
The linguna, the hair.
Yes, you got it. You said it right too. Okay. What about their menstrual cycle?
Amenorrhea.
You got it. Amenorrhea. Okay. So it's going to be an absence of their menstrual cycle. Okay. All righty. So those are just some of those things of looking at your anorexia. So anorexia is a topic. And abuse. What do we know about instructing a patient about an abuse? Lashiba, hit that one.
So I'm gonna be honest, I did not look into it as you told me to.
Oh, okay. So tell the group what an abuse is for.
It's let me get it right. Is it the withdrawal symptoms?
It's to cause a person to become what with alcohol if they take
Violently get sick.
Violently get sick, right? Okay. So what would we teach them then, so that they don't become violently sick?
They can't use anything with alcohol in it, like the mouthwash or colognes or perfumes, anything that has any type of alcohol in it, because it can go through the pores or whatever.
Exactly. So no sanitizer. So they've got to read all the labels. They're also not going to be able to do any painting, so house painting, any of that kind of stuff. If they want to, to freshen up their house, they should not be doing any of that. They need to hire somebody and not be home when it's getting done. So they have to consent to this. You can't just start this. This is something they have to consent to do. So it's very important that all that education is done ahead of time. That also with this instruction, they have to be taught that so say they want to, I don't want to take this anymore and I want to start drinking. They need to understand that they can have what we call residual effects. And so they need to abstain from alcohol use after their last dose. They need to wait at least 14 days, up to 14 days. They can have a potential reaction. And then they need to understand what the reactions can be. It can be a severe headache. Their face and skin is going to get very flushed. They're going to get tachycardic. It can get so bad that they can actually end up having a heart attack because the tachycardia can get so severe. Nauseated, potential vomiting can happen. So it's an adverse response. So when we talk about that, aversion treatment therapy, this is a drug that can really emphasize that. Okay. So antidepressants. What are antidepressants? What? Tell me. Let's see. What do I want to use for? Tell me how long it takes for an antidepressant to kick in and work.
7 to 21.
7 to 21 hours, days, months.
Days.
Thank you. Okay. So usually we're looking at a 2-week period of time to get the full effect. It could take up to 4 weeks. And what's that called? What's that term? Does anybody know what that means? What that term is called? Incubation. So introvement, introvement time, which means improvement time or turnaround time. And so that, if you see that term, that's what it's asking. How long does it take for it to start kicking in to see improvement? Okay. So what are side effects to antidepressants in general?
Can you repeat that question? I couldn't really hear it.
Oh, what are side effects to antidepressants?
Potential weight gain.
There could be some, but that's not the big one for antidepressants.
Well, it can give them the motivation and the energy to commit suicidal, that suicidal ideation. It could give them that motivation and energy for it.
Yep, suicide risk is there. The suicide ideation, thought, and the energy to do it, that can be a risk for it. What else can be side effects? especially like your SSRIs, the first ones that we try a patient on these days.
Dysfunction, erectile dysfunction.
Erectile dysfunction, libido issues,
Jittery.
jittery. What about the GI issues?
Stomach pain.
Yep, nausea. Some people get diarrhea because of the serotonin components. Okay, so think about those. Look over the side effects on your antidepressants. Okay, because I don't know which ones they'll pull out at you, but look at the generalized common themes and then look at the specifics for each group: the tricyclics, the MAOIs, and the SSRI groups. Okay.